Greg Peterson, the Roseville Fire Department Battalion Chief. The Roseville Fire Department's been part of the Alzheimer's Dementia Community Action Team since September of 2013. The reason I got involved with Alzheimer's and dementia is because of a couple of reasons. I had done a research paper on this as a part of National Fire Academy Executive Fire Officer Program about a decade ago, realizing that the population in the city of Roseville was aging, was only going to get older, and that there were some issues we were going to encounter along the way and try and be prepared for that. Additionally, my dad was diagnosed with Lewy bodies disease, and so this group, as it came around, fit in very well with my personal life as well as what was going on with the department and the community as a whole. The department itself has done a number of things. We have been involved with ACT on Alzheimer's, in all the different events associated with that. We also have created what's called the Vital Life program, a program in which we help to track and organize people's personal information, and that information on an emergency basis is very important to us, so that we can properly treat and recognize what's going on with a patient. We encourage people to fill out this form, and then it's a bright red envelope that they stick on their fridge, which makes it easy for us to help to identify what's going on with them when we show up in an emergency. The majority of calls we go to in the city of Roseville are medical calls, and the majority of those calls have to do with an elderly population. Additionally, fire calls we are going on oftentimes stem from previous medical conditions that are involved with elderly issues within the city itself. The lessons that we've learned along the way are many. We realize that there's probably a greater need than what we can currently handle, but we're continuing to recognize that and develop programs as we go. We've also been part of advanced care planning and honoring choices programs that are out there, helping to give a point of view from a first responder, paramedic, EMT level. What they determine they would like done helps to determine what we do when we get there, in terms of care or resuscitation or not resuscitating, but which has brought a very unique point of view to the audience that has seen these presentations. We've also been part of an emergency search program that is part of the Ramsey County program, in looking for people. In case of an emergency, if somebody has a tracking bracelet, we can go and find them. And this is done on a countywide basis, and we've been involved heavily in the development of that. Also, the Community Health Awareness Team is something that we're a part of, which is an extension of elderly issues and going out and helping to support the community, identify what needs are out there, and integrate the fire department into those needs. And lastly, we are starting to develop a safety program that's based in the National Fire Protection Agency program called the Remembering When program, which helps with home safety and fire safety specifically, and dealing with older adults, trips and falls. After the ACT on Alzheimer's grant ended, we went back to our roots, which was our community-based group. That group continues to be very active within the community, and we continue to support that effort any way that we can. Our efforts in all these programs have paid off, as we have received a number of comments and thanks from the community for our involvement and our understanding with the training that we've gone through and our awareness of the issues that are out there and the people that we deal with.